Hello, everyone. Welcome to Pre-Health Shadowing. So I'm going to be going over a quick startup presentation to introduce you all to our organization. So give me 1 second. Okay, so I'll be going over this presentation. So Pre-Health Shadowing is a student-led, minority-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Sahasra, and I am the lead of live sessions at Pre-Health Shadowing, and I would like to thank you all for attending our session today. So just a little PSA, we do have closed captioning to accommodate students of all abilities and needs. And if you have any ideas of how we could be more accessible, then please let us know at info@prehealthshadowing.com. If you would like to save us as a contact to keep us out of your spam, then feel free to do that. You can also join our email list to never miss a session. Also, if you'd like to stay in the loop, we have both Instagram and TikTok, and the handle is the same for both of them at Pre-Health Shadowing. And we do host students from all over the world, so please let us know in the chat where you're calling from today. I'm calling from Texas. And if you're interested in being a part of the Pre-Health Shadowing team, then you can visit our website, and you can either become a student volunteer or a Pre-Health Shadowing team member. We also have various leadership roles available within our organization, and you can see just a couple of those on the screen here. If you are a high school student, you can join our High School Training Program, or HTP, which is offering leadership and healthcare education for pre-college learners, and you can see an application on our website or the link here. We also do publish articles, and you can submit them at www.prehealthshadowing.com/blog submissions. Again, we are a free program, and in order to ensure that we stay free, we do run solely off of donations, and we would greatly appreciate if you could donate. If you are not able to, simply spreading the word would be great. If you have any questions throughout our presentation, please type them in the chat, and we will answer them during our Q&A session at the end. Also, make sure to take good notes, as we will have a post-shadowing assessment where you can earn a digital certificate verifying your hours for our professionals course page. And if you could, please turn your cameras on to help this experience be more personal. And now I'm going to pass it on to Dr. Rinde to take on the speaking session.
Hello, everybody. Thank you for having me, Sahasra, and it's a pleasure to be here with you all. I am Dr. Adam Rinde, and I'm actually I live outside of Seattle, Washington, in Bellevue, Washington, and we're actually recording this from my clinic room, so you actually are as close to shadowing me as we can get in this scenario. I would just love to start off before we get into the presentation with a show of hands of anybody who's ever heard of naturopathic medicine and or been to a naturopathic provider. Just so if you could kind of raise your hand and let me know, just so I kind of have a sense of the familiarity of the group to my profession. So it looks like a few comments are coming in, and thank you for doing that. So today, I'm going to take you through a brief kind of overview of naturopathic medicine, because many people aren't familiar with it. I'm going to spend a lot of time just giving an overview about what it is, the background, the education that we receive, some of our licensing issues and states that we're licensed in, our scope of practice. And then I'm going to go more into my personal story as we get further into the presentation, and talk about kind of my day and what I do day-to-day life, and kind of things how I address my practice, and then we'll finish with a Q&A after that. So let's see here. So first of all, gonna give you an overview of how I feel I define myself in my profession. And as a naturopathic physician, I consider myself a physician, a teacher, and a guide who helps people prevent, reverse, and manage illness using root cause directed and supportive approaches that aim to balance the physiology and biology of the body without causing additional harm or disruption. Also, I consider myself a physician entrepreneur because I do own and operate my own clinical practice. I'm self-employed, and so I have all the responsibilities of being a physician and also a business owner, which is very common in my profession. It's actually very uncommon to be employed by someone else. The license and degree I have to practice this is called a ND, which is a doctorate of naturopathic medicine. In some states, it's called an NMD, which is a naturopathic medical doctor. And so in the state of Washington, we're called NDs. And my practice specializes in gut health, brain health, and metabolism. And so this is my background. And I have a bachelor's in science from the University of Arizona, and that's where I did my undergraduate work. And then I went after that into a career, bounced around a little bit, and I'll tell you more about this journey. I was in marketing, nonprofit fundraising, coaching, strength and conditioning training, and then I ended up getting to do my pre-med work at San Francisco State University, and finally was admitted and finished my doctorate at Bastyr University in Seattle, Washington, which is one of the top accredited universities for naturopathic medicine. And then I finished my degree there, and then I went to a residency in naturopathic medicine at the teaching college up here in Seattle called the Bastyr Center for Natural Health, where I was a resident. And then shortly after that, I became on clinical faculty there while also launching my private practice clinic, which I've had here since 2007 called Sound Integrative Health. I also launched a podcast to help with educating the public on different health topics and interviewing experts in all fields of medicine. Since 2019, it's called the One Thing Podcast. And so it's something I'm passionate about as well. So we have a couple things to go through on this slide here. I'm going to talk to you about what naturopathic medicine is and how it fits within the greater context of medicine. So we have really 4 areas that naturopathic medicine intersects with. Allopathic medicine, which is what most people are commonly familiar with, which is an MD. And then there's integrative medicine, which is a form of medicine which tries to sort of fuse conventional medicine with alternative medicine. And so there's specialized postdoctoral programs, such as one at the University of Arizona by Andrew Weil, that after you get your MD, you can go and do a fellowship in integrative medicine and learn how to combine the two worlds of more natural supplements or natural approaches with conventional approaches. And then there's functional medicine, which is sort of was born from naturopathic medicine, which uses more of pathophysiology based treatments using nutrition, hormones, herbal medicines based on a system called functional medicine. And this uses a lot of lab diagnostic tests and alternative lab testing to address health imbalances. It's very similar in nature to naturopathic medicine, but I think the main difference is naturopathic medicine fits into this grouping as it complements and supports allopathic medicine. It can also be used as an alternative to allopathic medicine. And it's really a system and philosophy of medicine based on a specific kind of approach and methodology to addressing health. So it can stand alone as a system up until a certain point where we no longer are probably the appropriate choice, and that would be kind of in like emergency medicine or surgeries. That's not really something that falls within the naturopathic medicine field, or acute diseases. That is something that not necessarily falls into naturopathic, the naturopathic realm. So,
Dr. Rinde, sorry to
yes.
stop you short. Could you try sharing your screen again?
Oh, okay, sure.
Perfect, thank you.
Okay, so I'm just going to go with this view because for some reason, did you guys not see any of that last part? Okay. So let me just kind of go back a little bit. Just this was the overview of who I am and kind of my background. I talked to that in some of the places I've been and degrees and places I've studied, and sort of what I'm up to today. And I talked to that, and I was just going through this slide here, which was talking about the kind of 4 ways that we intersect with the greater healthcare system of medicine. And I think this is a important slide to really kind of understand, just because there's sort of these 4 camps: allopathic, integrative, naturopathic, and functional medicine. Integrative medicine is usually a fellowship that's done after you've done your allopathic training. So you can learn how to combine Western medicine with integrative or complementary and alternative approaches. Naturopathic medicine is a system and an education on its own. Functional medicine is kind of, from an educational standpoint, is something that a lot of people will add on after having frustration or interest coming from the allopathic world of wanting to do more holistic type care. And it's sort of earned by attending seminars and courses and postgraduate classes. It's not a degree in itself, it's more of a certification, and it's easy access also for people who just want to be like a health coach, or people coming from the nutrition world that want more advanced ways to help people. Naturopathic medicine is getting a degree in naturopathic medicine is like a 4-year program, post-undergrad program, medical school. And it's designed to train you in a system of medicine that could, in a sense, stand on its own in most healthcare situations. However, in situations like emergency care and surgical care, that's not something that really falls into the naturopathic medicine world. As you'll see later, naturopaths not only do natural medicine, but can also prescribe conventional medicine. So it really is a system in itself. So naturopathic medicine has a long history. In fact, before the pharmaceutical industry really started to develop in the 1920s, naturopaths and homeopathic doctors were really considered a main part of healthcare. Herbal medicine, nutrients, homeopathic medicines were used quite a bit when the pharmaceutical industry was developed and drugs were developed more in the 1920s. Naturopathic medicine fell out of favor for a number of years and sort of disappeared in the 40s, and then kind of resurfaced a little bit in the 50s. And then really, as the 60s and 70s, in the 60s and 70s had a real renaissance, and naturopathic schools were reopened. And today it's really taken off and it's a very popular choice of medicine for people. And I'd say it's like on a real big upswing as a profession. But there was a period of time where it really just disappeared because of the newfound strength and options within the allopathic medicine field. Currently, we have these 5 accredited institutions in North America. And what I mean by that is, like, anybody can call themselves a naturopathic doctor by going online and taking some type of online course for a little while and getting like a diploma. There's a lot of online institutions that are not accredited that people might say they're a naturopath, but there's only these schools that have undergone the federal process of being an accredited naturopathic doctoral program, where we have to sit for a national board exam to be to receive our license to practice and to be able to practice as a and get an NPI number, National Provider Index number, which means you're an official healthcare provider and you're not you're safe and qualified to interface with the public. Beyond that, we naturopaths have to hold malpractice insurance. Naturopaths have to have a state license in certain licensed states to be able to practice. There's a lot of people that are doing programs online that don't fall under these strict guidelines and have not had to go through strict accreditation process. It is very difficult to become an accredited medical educational school. It takes years and years to get this qualification. I went to Bastyr University, which has 2 campuses, one in Seattle, one in San Diego. And then the oldest school is actually in Portland. That's been around since the 50s, National University of Naturopathic Medicine. And then one of the newer schools that got certified is the one outside of Chicago, National University of Health Sciences, and a great school up in Toronto, Canadian College of Naturopathic Medicine. Sonora University in Tempe. It used to be called Southwest College of Naturopathic Medicine, but it was recently changed names, has been around for at least 20, 23, 24 years. Bastyr University has been around since the late 70s, I believe. And these schools are, sort of the top and actually only available accredited schools in the country. It's important to know that naturopathic medicine is not accepted everywhere as a licensed profession. When I started out in the profession, and when I entered the profession in 2001, I think there was 9 or 10 states that we could claim on this map that have some type of licensure or regulation or scope of practice that's considered official, but it's really expanded. And now we're starting to be licensed in major population areas. Massachusetts was one of the latest. When California was licensed in 2003, that was a big deal. And the East Coast is really catching on. Pennsylvania, Maryland, like I said, Massachusetts. And these states, what that means is that if you practice naturopathic medicine in these states, you sort of are accepted as part of the healthcare system. If you set up shop to practice naturopathic medicine in an unlicensed state, you're sort of kind of on your own, and it's not as accepted, even though there's a high demand pretty much everywhere in the country for our services and for our care, and people want our care. It takes a lot of years to actually be accepted as a profession. You can imagine that there's a lot of skepticism about a profession that's not an MD level or doesn't have the MD certification near it. So the work that took to kind of get full licensure in these states was years and years. In Washington State, where I practice, I'm considered a primary care physician. I can order any lab. I can prescribe almost every medication. I interface with every specialty. I can receive referrals. I can take insurance. I can pretty much do anything a family practice doctor can do. That's an MD. That took years and years and years to prove that we were safe and reliable and a valuable asset to the healthcare profession. But this is dramatically changed, like in the last 5 to 10 years. I think we've at least added a state or two every year. So it's really catching on. And once New York licenses us, then pretty much everything else will take suit from there. That's kind of like the only really, that in Illinois are kind of like what's probably holding back the rest of the country. So naturopathic medicine, has as a whole is considered like a holistic medicine. And so what we're going to be talking about is just how that's viewed in the greater context of healthcare. We use a lot of science in what we do, even though it's considered holistic. I consider naturopaths more what's called a pathophysiologist, meaning like if you're thinking about a disease process, you're not thinking about like what's the way to suppress the disease with a certain medication. It's more of what's the underlying process that's going on in the body and how do we balance it. So understanding inflammation, understanding the disease process will help us choose modalities and treatments that restore balance versus, for example, a perfect example is like acid reflux. Yes, there might be some acid, excess acid in the body. However, if we just take an antacid, that's not necessarily addressing what might be going on. Is there problems with the digestive process? Is there problems with the gut lining? Is there problems with the way the person is reacting to the foods, with the immune system? There's lots more that naturopaths try to think about when addressing health concerns. So I'm going to talk about the principles of naturopathic medicine because that will really help you understand us as a profession. I like this slide because this kind of gives you like a nice little view of what were kind of all the different eclectic things that naturopaths do, from anything from minor surgeries to putting together herbal medicines to doing lab testing, physical exam with physical medicine, nutrition advice, counseling. There's just a whole eclectic group of things that naturopaths do. Principle number 1 is first, do no harm. And that's like common in, pretty much any healthcare profession. But I think it's a strong principle of naturopathic medicine because we're trying to use methods and modalities that have limited side effects and try not to suppress the body's healing process and trying to use the least force necessary. So, usually naturopaths try to start treatments that are going to be supportive and not invasive. I'll give some examples of that later. Principle number 2 is naturopathic medicine believes in the healing power of nature. And so this is sort of based on the principle that the body can heal itself if you support it in the right way. So this is a term that's in Latin, is called the vis medicatrix naturae. And so what the naturopaths believe is, the body will eventually try to find its way back to homeostasis in most health conditions. Of course, there are some where it's way more complicated than others, but in most, in things like colds and flus and maybe, skin disorders and other, sort of not life-threatening conditions, if you stimulate the body in a way to kind of restore balance. For example, like the biggest thing is like when you get an illness or a cold, it's like you lie down and rest and hydrate and maybe have some chicken soup. You're really restoring the body's own ability to kind of fight the infection off, rejuvenate and restore itself. And naturopathic medicine tries to do that on many levels, regardless of the condition. Principle number 3 of naturopathic medicine is find the root cause. And that finding the root cause is not always a direct line, but naturopathic medicine tries to understand like what is beneath what's the driver, what's the root cause of an illness. So perfect example, like in my specialty is like inflammatory bowel disease, or like I help a lot with Crohn's disease and ulcerative colitis. And so there's the disease process, which is the body's attacking itself. And so the conventional medicine will help a lot with basically helping people stay alive and using disease modifying medications that block the immune system from attacking itself. So for example, like Remicade or Humira, these biologic medications will halt the immune system from doing the advancing the disease. But is that the root cause? Well, the root cause is not the cytokine that in the immune system cells that the drug is blocking. The root cause might be something else. So naturopaths try to find like what's underneath it. Is it a microbiome issue? Is it something from the diet? Is it a microbe, like a pathogen or an infection that's driving it? Is there something like heavy metal accumulation or environmental toxicities? What's the root cause that's driving the body to react this way? Of course, all disease have some genetic basis, and there's an understanding that. And what we're trying to do is find the cause and hopefully remove it, or at least support the body in dealing with the root cause to help with better outcomes. Naturopathic medicine in that situation is not an either or kind of option. We usually value the fact that we have to work together with conventional medicines sometimes, and where they don't shine, we can shine. And with sort of life-saving measures that in real extreme situations, conventional medicine might shine better than naturopathic medicine. The fourth principle is doctor as teacher. And so this is something I really love, and that is the Latin term is docere. And what we recognize is there's sort of a collaboration and relationship that is very healing and therapeutic between the patient and the doctor. And the doctor needs to have that approach with their patients, that they're a guide, a teacher, a collaborator, and is really educating the patient and working with the patient to advise and empower them, instead of sort of telling them what to do and sending them out the door. It's really teaching them about what's going on with their body, helping them become their own healer, and helping them learn about their body and their own tendencies and things that they can do on their own to kind of coach them along. And it's very therapeutic to have that kind of relationship. And I've seen over the years, the more comfortable I've become as a doctor, that sometimes the relationship and the collaboration with your patient is ultimately one of the key factors in the outcomes. Principle number 5 is treat the whole person. And we recognize that health and disease is multifactorial, and we try to think of the whole person when addressing an illness. So for example, perfect example is like acne. And you can think about acne as what's wrong with the skin, and you can do things like put topical steroids on, or Retin-A, or sort of Accutane, and kind of really hone in on addressing that the skin is the problem. But in a naturopathic medicine, we look at other drivers, other factors in a skin disorder, such as the gut and the intestine and the liver, how well the liver is detoxifying out chemicals, and if the gut is dealing with something called dysbiosis, that's feeding inflammation to the toll-like receptors in the skin. And we also think about the microbe component in the skin. We think about barriers and nutrients that might be involved with skin health, such as omega-3s. And we also think about things like stress and how that might be driving up certain dietary patterns. We look at food allergies. It's sort of looking at the whole complex of things that can be involved, and so that the patient's individual disease process is being addressed versus sort of just the one size fits all or suppressive medications based on the organ involved. Principle number 6, we think about preventative medicine. We look at that, if we can prevent minor illnesses early in their tracks, then we can prevent them from becoming more serious. I always say that naturopathic medicine really shines the best in mild presentations and mild to moderate presentations of any disease state. So a perfect example for me for this is today in my office, I had a patient who had mild hypertension, 130 over 180, and wasn't quite ready for medications, like a lisinopril or a calcium channel blocker, but a family history of kidney disease and a family history of stroke, and really wanted to get on top of this blood pressure. And so we were able to address that blood pressure early on and get it in control with very simple modifications, minor diet changes, increasing potassium in the diet, increasing magnesium levels, working on some mind-body meditation, reducing stimulants, watching salt intake, and a few nutrient supplementations, and the blood pressure is under control. It's back to normal. We're preventing a minor situation from becoming a major situation without having to take a medication. The patient can now watch it for that they know that they have a tendency towards this. They can prevent it from becoming more of a major problem in the future. And principle 7, we really promote wellness, which is like the optimal state to be achieved. This is a state where people are just feeling well, living their life, playing, sleeping well, able to go for their goals in life and dreams, and they're spending more time out in the world than they are in doctor's office. That's sort of what we're helping. We want people to not become dependent on doctors. We want them to kind of live and, just use a doctor for an annual visit and wellness checkup. And if that's what we can do and help everybody achieve, that's sort of the ultimate goal. Because we talk about, with all of our patients, nutrition, lifestyle, exercise, sleep, and kind of those foundational things to help people live as well as possible. Ultimately, if you can master most of these foundational things and stay good in those areas, you can prevent a lot of disease and stay well. So I'm just going to keep going, if that's okay with everybody, and then we'll get to questions here in a little bit. So I want to talk about what's unique about naturopathic medicine. So we've talked a little bit about the principles, and let's go into the education that we receive. So throughout the naturopathic education, there's sort of a basic science process, a clinical science process, and then there's also clinical training. So during your first part of your education, it's really hardcore basic sciences to have a foundation. Most people enter into the profession having at least the pre-med requisites. They don't have to be, they don't have to have a pre-med or a science degree. They have to have a bachelor's degree, but they've had to have complete the pre-med requirements. So, the organics, the organic chemistry, general chemistry, physics, biology, statistics, all that stuff. And then when you get into school, you start, the first year is like really hardcore basic sciences. It's a four-year educational program, but really, really intense. Most of the professors are coming from the medical schools in the area, and just a very intensive, challenging, stressful start. And you're doing all the anatomy, physiology, biochemistry, etc., to prepare you to have a foundation to think clinically. And then those are the first 2 years, the basic science. You take a board exam between the second year and your clinical years on basic sciences. And then you go into clinical sciences. And clinical sciences are listed here. And these are, similar to medical school curriculum. This is all looking at disease process, pathophysiologies, treatments, assessment, physical exam, testing for all these specialties. And you're kind of going deep into all these areas. So learning about cancer, GI problems, endocrine problems, cardiovascular problems. Then there's specific deeper training in diet and nutrient therapy. And that's unique to naturopathic medicine. So very similar basic science education to an allopathic MD, a little bit more basic sciences that's offered in naturopathic schools, just from a standpoint of a little bit more intensive of hours spent studying some of these, especially the anatomy. We have the whole cadaver. We've had the whole, at least when I was in school, we had, the full cadaver labs and all that stuff. And really can't emphasize how challenging this program is. And it's almost like, at least when I was going through school, I felt like they were extra hard on us because they knew that we were, sort of a emerging profession, and we need to know our stuff if we were going to interface in the world. What's also unique about the training is how much we go into natural therapeutics, whereas allopathic medicine really doesn't get into too much of that. So 12 credits in nutrition, 12 credits in counseling and health psychology. We get trained in manual structural adjustments, which is kind of like commonly known like a chiropractic adjustments, but we call them orthopedic adjustments. Botanical medicine, pharmacology, which is study of drugs, and homeopathy, which is a special kind of branch of medicine that is 8 credits. So naturopathic medicine is unique because it has some different methods that we're using. So I'm going to kind of roll through these. Like botanical medicine is a big type of medicine we use. Traditionally, botanical medicine has been used, back, biblical times. It's very long history. And we use a lot of herbal medicines to address disease and balance the body. For perfect example is, like there's an herbal medicine I use a lot for anxiety called rhodiola, which has a long history of use and works on, if you study the pharmacognosy of it, you can understand that it balances dopamine and norepinephrine, and it kind of helps certain people that have issues with anxiety and kind of feel more balanced. And we learn all the details about botanical medicine, and there's coursework and clinical experience related to that. And one of the things I loved about botanical medicine personally is that we actually have like a dispensary that you learn how to compound and blend herbs and come up with your own formulas and applications, and mixing the herbs and then prescribing them in real time, which is a fabulous experience for to learn. We also get a lot of training in nutrition. I mean, obviously, nutrition is a foundation to health, but it's often overlooked in other fields of medicine because there's no time, or just the patients, the doctors don't have the training, or the list goes on. But we believe, as a naturopath, we believe that food and what we eat and what we put into our body is essential to addressing disease, but also preventing illness. So we spend a lot of time learning people's diets, nutrition, making recommendations on what is appropriate for their particular health and their particular beliefs and philosophies and cultures, and trying to help people adapt a nutrition approach that's sustainable and appropriate for their health. So we get a lot of training on kind of micronutrients, macronutrients, food allergies, digestive related issues to nutrition, weight related issues. This is a picture of one of the cool things is there's actually a kitchen where you learn, there's some classes you have to take on whole foods cooking. And, that's one of the women in the picture is actually an author, Cynthia Lair, who's written some whole foods cookbooks, and she's like an instructor there, and you learn how to cook healthy. Like if a lot of people who come in this profession already have an interest in this, but some of us thought we did, and then we learn that it's actually fairly easy to live this way, and you don't have to have a lot of money, you don't have to know a lot about cooking, and when you learn and practice and do it yourself, it's easier to teach people. So a lot of emphasis on nutrition. And then there's another emphasis on something called physical medicine. Some people really gravitate to this in our profession, which is the use of hot and cold therapy, sauna applications, manual therapies like soft tissue work, massage, and exercise, sports medicine, just sort of a hands-on approach that actually becomes a major focus of a lot of people's practice, with helping people in that realm. Some people get the training and don't usually use it in practice. Other people, they really focus on that. I did a lot of physical medicine early in my career, in my practice. I thought it was a great way to help people and get comfortable working with people. At this point, I don't do a ton of it. However, there is, certain modalities that I still talk a lot about with my patients, such as therapeutic exercise and how to deal with injuries. And I usually interface with physical therapists and massage therapists and chiropractors to do a lot of the hands-on work, though, in my practice. And then there's counseling. We do a lot of counseling with helping people with their kind of health-related issues, transforming, kind of barriers to health anxiety. We talk to them about their stress, their relationships, barriers, what's getting in the way, other challenges, to kind of coach them along with getting better and, kind of dealing with illness, making changes. And, there are some situations, of course, where there needs to be more of an intensive mental health interventions where we refer out to psychotherapists or psychiatrists. But, they're counseling and being an ally and being another person that supports the patient and helps them with behavioral change or learning how to process stress or anxiety or sleep issues is a big part of what we do. And you can imagine in chronic illness, which is a lot of what we see, is there's a big need for emotional support. And a lot of people who come to naturopaths have had issues getting that emotional support from other healthcare providers, healthcare professions, and they really need someone to hold a space for them and talk to them about what they're going through and help kind of process their experience. Then there's a system called homeopathy, which again, not every naturopath practices this, but we all learn it. And some people really specialize in it. Homeopathy is a system of medicine in itself, origins in Europe, which is they use a diluted substance of some type of herbal or substance, that's been diluted into a very minute amount. And homeopathy is very hard to explain how it works, but in a sense, it stimulates your body to have a healing response based on giving it a dilute amount of something similar. So, for example, the medicine uses substance that can induce the immune system to have like a reaction. So if someone's having like a flu, homeopathy might be given. There's one called oscillocossinum that stimulates your body to have mount a slight little fever or a slight little immune response that fights back against the infection. So I personally don't practice a lot of homeopathy. I use a lot of nutrition and counseling and herbal medicine and nutrient therapy and hormone therapy and some other modalities. But I have colleagues that really just believe in homeopathy as a means to helping a lot of conditions. So some people are really gravitated to it. And then finally, one of the unique things is the patient approach. So you're kind of trained in this therapeutic order, and as you get more experienced, you kind of work with this as a model. But in your clinical training and your school training, you learn how to process through a condition and how to select therapies for patients. So the therapeutic order works like this: is we start at the bottom in all cases of disease. So let's say, for example, we're dealing with someone with a condition like cardiovascular disease. So, with someone who has atherosclerosis, high cholesterol, hypertension, and we would start with what's called determinants of health. These are things that are basic foundations of health to help the person, such as getting better sleep, getting walking, and working on their stress management, and working potentially on weight management, and really foundational things as our first kind of line of approaches. And then the second thing is stimulating the healing power of nature. So a lot of times this can be done through homeopathy. It can be done through modalities like exercise or massage, or referring out to acupuncture. And we kind of move up and then do what's called tonifying systems. So with someone with cardiovascular disease, we'll work on balancing those systems related to the cardiovascular system. So the vascular system, the heart, the kidneys, and you can tonify those, meaning balance those with herbal medicines and nutrients. So with cardiovascular disease, we might be working on helping the heart function better, reducing the pressure, blood pressures, and we also might be working on helping kidney function. And so we're holistically looking at the whole body, sometimes using labs and other physical exam modalities to kind of figure out what systems need support that's related to that heart disease. In some conditions, we'll correct structural integrity, which basically means like helping the body with muscle pain or musculoskeletal alignment. Sometimes it's not applied for certain conditions, but in others it's really appropriate. Then we'll work on if all of those steps are not helping the patient get better, it will move up the ladder of therapeutic order, and we can do some symptom-based natural prescriptions. So for example, with cardiovascular disease, we might prescribe something called red yeast rice or fish oil to lower cholesterol and reduce some of the plaquing that has started to take place. Some people might use like vitamin K2 to do that. And then if we're not seeing the heart disease reverse or improve, then we might move up further to symptom-based synthetic prescriptions, such as, prescribing a statin for some people, or giving blood pressure medications, prescribing some weight loss medications if the patient is really not responding to the lower force interventions. Then finally, we might refer out to higher force interventions, such as seeing a cardiologist for looking into if there's any need for stent replacement or any imaging that's needing to be done to explore if there's pending cardiovascular disease blockages. We just kind of move up the ladder. Now, in reality, if the worse the patient is doing, the higher sometimes we have to start on the therapeutic order. The more mild or kind of free or preventative we're doing, the lower on the therapeutic order we're able to start. And that's one of the important things about naturopathic medicine is like you can start at anywhere on the therapeutic order based on what the patient's presentation is. When I was trained, there are some like old school naturopaths that never veered from this process. And it was amazing to see the trust they had in this process. Most of us, in reality, will jump in somewhere and might skip a few of these steps just because, if someone's really sick and you're asking them to do all these really hard things right from the get-go, they might just feel depleted or discouraged from that. So sometimes we just want to get them feeling a little bit better first and then kind of back down and work on some of the harder things. All right, so we're getting close to the Q&A, and a little bit more just summary of what we can do. So naturopathic physicians can provide primary care, like I said, do counseling, diagnostic tests. We can prescribe natural medicines, and in licensed states where you have a scope of practice, you can prescribe pretty much most non-scheduled drugs. There, in my state, I can prescribe 2 scheduled drugs, but scheduled drugs are usually required for specialists, but we can prescribe antidepressants, hypertension drugs, cholesterol drugs, you name it. The kind of non-addictive drugs are usually in our scope of practice. We perform office exams, physicals and gyne exams. We collaborate and do all those other things. All right, so I'm going to kind of skip over this one a little bit, but just and maybe circle back to it. And I'm just going to talk about my own personal, how I ended up here in naturopathic medicine, because I really haven't talked at all about that. But this is me as a 3-year-old, and so I was kind of look back and be like, wow, how did I get to this point? And so I'd say there's like some key things that influenced me into naturopathic medicine. This is a picture of my father who recently passed away. And my father was he was a president of a big hospital, and more on the administrative side. And he's an engineer by training, but even as a president of a hospital, like early on in my life, he exposed me to some alternative healing modalities. This is him doing something that he loved to do, which was meditate. And, he sort of showed me this other way of viewing the world at a very young age was different than just sort of healing disease from taking medications. And at one point, he took me to a alternative medicine hospital and kind of showed me, it was more of an osteopathic hospital, and introduced me to that. It was just sort of interesting to kind of grow up with him as my dad. And I always wanted to be like my dad, or wanted him to sort of accept me and, kind of think highly of me. So I was really interested in what he was interested in. One of the things that he was really interested in was basketball. So I spent pretty much most of my life trying to become a competitive basketball player. And, I was really into training and playing at a high level. That was kind of my thing. I was around athletes all the time and just kind of really put my all in my life into basketball. And so far that I ended up becoming, that's me on the bench here at the University of Arizona. I was working with the team because I ended up not reaching my limit as an athlete and started getting into coaching, and I was a manager for this team at the Arizona for like 4 years, and then went into coaching, and sort of that was my dream. But then it kind of fizzled out, and I found myself working on the campus of UC Berkeley after I left basketball, and I was kind of lost trying to figure out who I was after that. I had this bachelor's degree. I was doing some fundraising for Berkeley, and I was around just people who were no longer jocks and were trying to like really figure out what they wanted to do in the world. And I got involved with just being around really, really intellectual people who were trying to make a difference, and was really inspired and it sent me on kind of a process of, I was living right by Berkeley and talking, and made tons of friends with really high achieving students, and just figuring out like who I was. And I realized that like this kid, has always been sort of like the kid who's caring, compassionate, empathetic, wanted to always help people, and was always involved with bringing balance to my family and friends. And I realized, I wanted to go into some type of health profession, and so I ended up shadowing an MD, and I was thinking about applying to medical school. And he had literally had a prescription pad. These were like the old school days with prescription pads, and he was convincing me not to do it during my shadowing session with him, and said, this prescription pad, I basically write 8 drugs each day. I know 8 different drugs, and that's my job. And he said I wouldn't go into medicine. So I was sort of like disenchanted, because I was really excited about the potential of becoming an MD. So I, at the time I was exploring nutrition and alternative medicine through other means. And I had a job at that time, eventually, that was sending me to nutritional conferences. I was selling advertising to nutrition companies, and I ended up at a conference, and these 2 doctors on the left, Dr. Peter Diadamo and Tori Hudson, were speaking, and they were naturopathic doctors speaking. Dr. Diadamo was speaking on ancestral connection to diet, and Tori Hudson was speaking on osteoporosis and breast cancer. And I was just fascinated with their discussions and talks. I went up to them and found out what they did, and they told me they were naturopathic physicians, and they both had written these books, and they told me how much they loved the profession of being a naturopathic doctor. And I was just threw myself into it and started learning everything I could about naturopathic medicine, was really drawn to it. And this doctor on the right, Carl Hange Bauer, I was living in San Francisco at the time. I started going to him as my personal doctor. He was one of the old school naturopathic doctors. He's still in practice there. And he was very inspirational, taught me a lot about my own health. I convinced him to let me be a volunteer at the clinic, and I started working in the clinic and going to night school for pre-med requisites, and ended up quitting the job I had and applying to Vassar University. I got in and ended up graduating. Here I am in the middle here, graduating with my class in 2006 after going through the program. And I've been in practice ever since. These days, I spend the majority of my day, this big pie chart, is seeing patients. I probably see 7 to 10 patients a day. And then the rest of the time is spent like reviewing labs and labs I've ordered, and doing an analysis and case analysis, and preparing for my patients. The good portion of the day, since I do own a business, is administration. So responding to emails, counting, paying bills, working with my assistant to make sure things are running smoothly and everybody has what they need. Then I spend a good deal of time doing research and learning to kind of keep up on the latest educational components. And so that's my current day. So I think that's a good place to start. I might come back to more of these slides if needed, but I want to open the floor for Q&A.
So while we're waiting for more questions to come in, one question is, what methods do you use to ensure your treatment plans are safe and effective?
Okay, that's a great question. So, um, research is a component of naturopathic medicine that I didn't really share a whole lot about, but there's a whole portion of our profession that basically goes into natural medicine research. And natural medicine research is one way that we use to assure that our methods and treatments are safe and effective. So we there are systematic reviews that have been done on particular medications that will review. There are reviews written, case studies, double blinded placebo controlled trials that are done that are the best form of knowing if something is safe and effective. And we try to apply those at all in all in when that's available. Because research is not largely funded by drug companies, then sometimes the funding for good research isn't there, and so we rely on a lot of long-term clinical case studies that have been using these modalities in treatments. Because there isn't a lot of harm done with natural medicine, the biggest risk we usually see is that it just doesn't work. So there's very rare natural medicines that will actually cause harm. It's just, do they work or not? It's really the big question. And so, I use some databases that have references. So if I'm considering a treatment that I've never used before, I'll go into the research and literature and look at what human studies have been done. And that's how, kind of stay up on things. And we have lots of continuing education. We're required to stay up on and do pharmacology clinical education and safety and clinical education ongoing. But usually it's just kind of using research, case studies, and in rare situations, like anecdotal evidence, is used in all professions.
Kind of stemming from what you were saying about the medicine either working or not working, what would you do if a patient was not seeing the results they wanted from your treatment plan, and how would you address the issue with them?
Yeah, so in the situation where the medication or whatever has been prescribed is not effective, you really have a couple of things that you have to do in that situation. One, the provider must question the assessment that's been done. So it's my job to say, have I done the right assessment? Have I heard the patient? Do I really know what's going on? What's the underlying problem? Am I addressing the right problem? Did I select the right medication or the right treatment for the particular problem? So that's part one. The second thing is you have to look at, is the medicine or treatment being done correctly, taken correctly, the right dosing, the right timing, the right frequency? Is there a different form of it that might be more successful? And a lot of times it's getting clear on, has it been prescribed correctly? If you've done the wrong assessment, then, depending on the patient's bandwidth and their understanding, then, you kind of do further testing and further analysis and reapproach the condition with different ideas or a different strategy. If it's dosing or those types of things or the wrong form, then you just make a tweak and you kind of roll out another trial with the patient. Finally, like sometimes you've exhausted your answers, or you need someone else to take a look at the case. And if the patient's not responding to your treatments, sometimes you'll have them see a specialist to get another opinion. But always, and having them come back to see you and be part of the team. We very rarely want to refer someone away without having them know that you're still working on and committed to their care. So sometimes it's just visiting with another specialist or someone to get a second opinion. Any other questions?
So in the chat, there's one question: is the MD path good for becoming a psychiatrist?
Yeah, I saw that. So I guess what I'm taking from that is like, if you want to work with like natural mental health versus like a psychiatrist, like an MD psychiatrist, that's like a very advanced training, and you're actually responsible to prescribe a lot of controlled substances and potentially addictive medications. So from that standpoint, no, getting an ND training would not qualify you to become a psychiatrist. However, if you're interested in addressing mental health with lower force, like medications, counseling, interventions, supplements, it's a great path. Like, mental health is one of the things that we really shine in. So helping people with depression, anxiety, insomnia, ADHD, neurodiversity. These are all things that natural medicine shines at helping people. So if you're interested in more of like a natural approach to mental health, it's a great course. But if there's like certain medications that you're wanting to use, at some point you might need to team with a MD psychiatrist to prescribe those while you're doing the other things. So I think Dusty is clarifying a little bit more and saying, want to provide CBT, cognitive behavioral therapy, while also being able to work with mood stabilizers as antidepressants. Yeah, I mean, if you practice in a licensed state as a naturopath, you can prescribe antidepressants. And in like in my particular state, I can prescribe antidepressants, mood stabilizers, and have for some people, and do CBT like counseling. I also work with these folks on their nutrition, their sleep, their gut health, their diet, like allergies, so many things that influence mental health. So I think it's a great field for mental health management, but just with the limitations that there might be some medications at some point that are out of your scope of practice. It's great to hear, Dusty.
So are there any cases where naturopathic medicine doesn't work and you have to turn patients away?
Yeah, I mean, I think the one thing about naturopathic medicine is there are situations where someone might need a surgery, or a situation if someone has a cancer diagnosis, if someone has a really bad kind of addiction problem, or needs hospitalization, if their disease condition is so unstable that they're hours away from being admitted to the emergency room, we have to turn those folks away, and you have to really screen when the right tools for that particular patient. I don't like the term turn them away. It's more of, you're part of the healthcare system and you're getting them to the right place, and then you're following up with them once they're more stable. So oncology is a perfect example. That one hits quite to home to me, because I had a son who died from cancer, and so like early on I was taking him to naturopaths, and we didn't know what was wrong with him, and they thought maybe it was something related to his diet or what have you. And it became very clear that my son was much sicker than sort of what naturopaths could help. And so, obviously at some point we found out that he had cancer and we were in oncology care. And he had to go through chemo and radiation and surgery. Along the way, we kept in touch with the naturopaths for helping him with um, dealing with his fatigue and helping his appetite and helping recover from chemotherapy, recover from surgery. So it was like a continuous loop. So it's more about when versus if. People with addiction might need to go inpatient and then come out and work with you, more about preventing relapse or reoccurrence. You just kind of, I think naturopathic medicine works when you don't see yourself as apart from the healthcare system versus you see yourself as we have our strengths, we have our place, and it's a very important place. And then when we don't, to know who to go to and how to facilitate that.
I'm so sorry to hear that. It's great to see that naturopaths are continuing to join a patient on their care, even if they can't directly care for them.
Exactly. Yeah, that's the whole thing. And I think that's where we're at. The profession's matured quite a bit. I think in the beginning, they're sort of like outcasts, rebelling, against conventional medicine, maybe, and the conventional medicine maybe didn't want to interface with them. And maybe that was sort of how the profession had to get started and jump started. But now we're, I think, in a place where the majority of us are really just wanting to provide the best of both worlds for people, like this really good naturopathic care and this interfacing with conventional medicine because you recognize the value of it. There is another question from Dusty. How do you feel about nootropics like alpha brain, etc.? Do they have a place in medicine cabinet? So there are people, so nootropics, just for people who don't know, or alpha brain, these are sort of natural supplements and nutraceuticals, natural agents that impact brain function, brain performance, like focus, memory, mood elevation, and those types of things. So, they have a strong place, I think, in helping people because so many people are, really struggling with those areas of brain focus, memory, and a natural supplement might prevent them from maybe going down the wrong path and getting involved with addiction or addictive substances. And so natural agents that they can take when they need them for helping with study or helping with learning or for mood balance are excellent. I think they've always been a part of naturopathic medicine. However, one thing you have to be careful about is like some of the ones that you can just buy online might not be made by reputable formulators or brands. And there's very low control over what can go into a supplement. Anybody can sell a supplement. So working with a healthcare provider that can source the right brands and ingredients and supplements is one of the things that a naturopathic brings value to. And so they're really important because they can prevent addiction. But at the same point, they could be slightly dangerous if taken the wrong substance. So I just have a caution against them because they're sort of it's like the wild west right now with nootropics.
So I think this will be our last question, but you're kind of saying earlier how you're constantly like researching into new things. Do you ever come across a treatment plan that you find is really cool and you think would be really effective, but you've never used before? And have you ever recommended it to a patient?
Yeah, that's a great question. And in fact, like probably once a week, I find something that I'm just fascinated by And, you know, that process of using a therapy that's new that you've never used before and actually discussing and enrolling a patient and attempting it is a process in itself. So, you know, for example, there's been lots of new therapies out there for this post post-acute COVID sequelae, or otherwise known as long COVID. A lot of people are struggling with this right now, and you know, there's some therapies out there that I personally have not used, and so what I generally do is keep up on the research and see what's been done and said and articles written, and try to attend some continuing education conferences and webinars on those modalities. And then I have like 10 really trustworthy colleagues that, you know, I have like on a chat group that we sort of go back and forth as to what, you know, what has been used, what they're seeing clinically, what they've used. And if it all kind of checks out as something safe and potentially effective for a particular patient, yeah, I usually tell the patient that I've done my research, I've done my due diligence, I feel confident in this, but you'll be you'd be the first person I've worked with this particular treatment with, and just be upfront about that, and then see if and ask them if they, you know, if they'd like to try it. And a lot of people, you know, once you've done that research and homework, and they give a chance to digest it and actually consent like that, then, you know, we'll try it, and that's how that kind of works.
Well, that all sounds so cool. I think we'll go to our wrap-up presentation. Thank you so much.
Yeah, you're welcome. I love the learning. Thank you.
Of course, we're so glad to have you.
Am I still on right now?
Yes.
Okay, I just want to say thank you very much for attending this. Obviously, you guys are very busy, and you know, I'm obviously passionate about this profession, and I also like to be completely transparent. If there's anything that you have questions that you have that did not get answered, or you just want transparent answers that maybe didn't come out in this presentation, you're always welcome to reach out to me. I care very much about the future of this profession, but most importantly, I care that the people who join the profession will thrive and have a healthy life and healthy and positive career. So if I can do anything to help facilitate that, let me know.
Okay, that sounds perfect. So we'll go ahead and wrap up the session today. So if you guys could type in the chat what brought you here today, and what are 3 major takeaways you got from the presentation, and what would you like to learn more about? Again, if you would like some recognition, we do post articles and blog submissions on our website. And if you'd like to be part of our team, we have opportunities for student volunteers and opportunities for you to become a pre-health shadowing team member. If you can, we would ask that you donate to help our program stay free and accessible to everybody, as we do run solely off of the time and donation of our volunteers. And make sure to take our post-shadowing assessment on our professional shadowing page. It is a simple 10-question multiple choice quiz based on the presentation, and you have 2 chances to pass it with a 70% or higher for verification of your virtual shadowing hours. Quizzes are open indefinitely for your convenience. And if you missed any part of our session today, you can visit our YouTube channel at Pre-Health Shadowing to watch any of our previous sessions for free. Be sure to catch our sessions every week on our website, and we'll see you next time at Pre-Health Shadowing. Please let us know if you have any questions.